Overconfidence of Technology. 7 days left until the 2024.2 CCE exam. So we are coming right up to the time where I want you to be as prepared as possible. You still have some time left to practice, but this should be time to polish rather than time to prepare new things. Now, of course, I wanted to run through then what are the common traps that people fall into for the CCE exam and how can you best avoid that. And one of the first things that's worth pointing out is overconfidence in familiar topics. So it's an easy trap to fall into for the day, that if it's simple cases, things that you feel particularly confident about, fantastic, but make sure that you don't fall into the traps of complacency, because one of the nuances of these exams is that they're often simple presentations, but sometimes with a little twist to there that has some impact on management. So yes, the patient may have a condition that you know very well, but take into consideration that specific patient's situation, their location, their particular history, any allergies. Focus in and ask yourself, okay, this is a simple case. How does that impact this patient in particular? So some of the big traps there will be comorbidities, psychosocial factors. So a good effort to dig in, reveal those things and see how does that factor into this patient's management. Of course, the point of this exam is communication, is showing that you know how to communicate to patients in front of you. So you do need to be, time crunch and all, as precise with your explanations as possible. Avoid using any vague terms. Try to not use any jargon that could confuse a patient. And this is particularly important for chronic conditions, mental health, or complex treatments where you need to make sure the patient really understands what it is you're trying to convey. And the easiest way to get around that is, of course, to engage the patient to repeat back information in their own words, as we would do in clinical practice, to make sure they're understanding. Now, the other benefit to doing that is that you'll probably find times where the patient will say, oh, I think I understand this. Can you explain more about X or Y? And that's often a bit of a fishing trip for the patient to actually try and tease out more information that they're wanting to check the boxes that they have to work out, do you know or have you answered the specific points of this case? And of course, inadequate psychosocial exploration. So we acknowledge that these are artificial cases. These aren't the same situation as you would be in clinical practice. We acknowledge it's very fake, but you have to have a certain level of buy-in and factor in the patient's psychosocial history, their emotional context, their emotional cues as well, to really assess that patient, particularly when dealing with mental health, chronic pain, those big ticket items where the emotions come into play as well. So always make sure you have a few questions lined up for that psychosocial history. You're open-ended, let them give as much information as they can. And you're going to find, if that's pertinent to the answers, the patient's going to start opening up and giving you information. Remember, they actually have scripts that they're trying to give you the facts. They just need the right question to be able to release that information. So open-ended is a good way to get that. Now, if they lean into certain areas, then add a few specific questions. Often there'll be kind of opening statements for kind of more broader questions, and then, if specifically asked, so look for those red flag items, and feel free to, you do have time on your side, as time precious as these are, so feel free, if you pick up on one of those things, just say, is that something you would like to talk about more today, or perhaps we could talk about it another time. That gives that patient the opening, as well as letting them say, oh, no, if it's not something that's relevant to that case. Now, helps if you hit the right button. We also have to factor into the fact that at the start of each case, it's going to give you the criteria that the examination is wanting you to fulfill to pass that case. And one of the usual things is address the patient's concerns. So make sure you're actually establishing what those concerns are, what their expectations are, and focus in on exactly what those issues are. If you haven't actually come out of that case having answered that patient's question or fulfilled their requirements, you're not going to do as well as if you've just given more generalized kind of statements. Which also factors into incomplete safety netting and follow-up planning. So again, we acknowledge these are fake situations, and sometimes it's easy to forget to plan that next stage and pretend that the patient is here. And of course, we're not going to solve every single problem in one single consult. That's not general practice. And so we should be factoring in a follow-up plan and safety netting. What are the red flag conditions? What are the symptoms that that patient needs to be monitoring? When do they need to escalate their care? And when would we have a more kind of routine review or evaluation? So big traps, easy to fall for. Please, please, please catch yourself and make sure you don't fall for those.